Hey, welcome to On My Watch. I am your host, Dr. Riz. Really excited to be here today. This is where we break down healthcare in a way that actually makes sense for real life. If insurance feels confusing, expensive, or completely out of reach right now, you're in the right place. Healthcare isn't one size fits all. Each of us has different needs, priorities, and budgets. But I am going to walk you through some points today, especially for Americans who don't have currently insurance or are looking for an affordable option. Hopefully, this would mitigate some of that added stress. So let's dive in. On January 1st, 2026, the extra financial help that made ACA insurance affordable disappeared. Premiums didn't creep up, they jumped. And for many people, monthly costs doubled or more almost instantly. Millions did the math and walked away, either dropping coverage or choosing not to renew because it simply didn't make sense anymore. Washington is still debating. The House passed a fix, and Senate is still evaluating. And that's why I'm doing this episode to help you understand your options, access care, and make smarter choices for you and your family's health. So, just to put the disappearance of subsidies in perspective, right? If you earn just bit above 400% of the poverty line, the federal help vanishes entirely, what's called the subsidy cliff, leaving some of the families with monthly bills that jump hundreds or even thousands of dollars. So the income threshold to qualify for a single person was around 62,000 and a family of 4 was around 128,000. Unsurprisingly, many people are opting out of coverage altogether, not because they don't need care, but because it simply isn't affordable. Based on preliminary data from the Centers for Medicare and Medicaid Services and reports from early 2026, roughly 1.5 million fewer people signed up for Affordable Care Act plans compared to the same time in 2025. What's the reality here? Losing insurance doesn't mean you lose access to care. It just means you have to be strategic about where and how you get it. All right, let's address the elephant in the room. Being uninsured is not a medical death sentence. It's just an invitation to play the game on a higher level. Think of it like this: you've traded in the automated pilot of insurance for a manual transmission. You still have full access to every doctor and hospital in the country, but the built in guidance is gone, which means you have to be the navigator. In this new 2026 landscape, your first choice could be your most expensive choice. The exact same health issue can cost you $50 at a primary care clinic or $5,000 at an ER. You make the choice, depending entirely on where you point the car. The emergency room is a fantastic tool for crisis, but it's the most expensive convenience store on the planet if you're just looking for an answer. In this new era, your knowledge is your actual insurance policy. The more you understand your options, the more you realize that being a strategic is the ultimate cost saver. So, this is interesting. When we talk about strategy, the most important decision you will make is the one you make in the first 5 minutes of the health scare. So, let's be clear, emergency rooms are for life saving miracles, not convenience. If you have a chest pain, signs of a stroke, or major trauma, you go to the ER without a second thought. That is what they are built for. However, for everything else, the ER is the most expensive room you will ever sit in. Even a quick check for something minor can result in a bill for thousands of dollars before you've even seen a doctor. In 2026, the move should be to go to urgent care. It is faster, significantly cheaper, and designed for the everyday stuff, the infections, the cuts, and I don't feel so good moments. Before you head out of the door, ask yourself the golden question: is this annoying or is this life threatening? If it's annoying, please go to the urgent care. If it's life threatening, go to the ER. That 1 second pause is the difference between a $150 bill and a $5,000 crisis. Another great option is the walk in and the same day clinic. They offer practical options for people who need care without the hassle of appointments or long waits. One of the biggest advantages is a flat upfront cash pricing, so you know the cost before you're treated, something that's still rare in healthcare. And waiting days for an appointment for a sore throat and fever or risking an expensive ER visit down the road, better go to that neighborhood walk in clinic the same day and get your meds. These clinics commonly treat everyday conditions like UTI, strep throat, rashes, cold, flu, etc. And many also provide vaccines and basic lab work, making preventive care accessible without a hospital visit. With convenient neighborhood locations, often right where people already shop, this model brings healthcare closer, simpler, and more affordable for those navigating without traditional insurance. Hey, how about receiving care from home? Telehealth makes accessing care simpler by removing many of the barriers people face without insurance. You pay directly to the healthcare provider, skip the paperwork, and see the price before the visit, which helps avoid surprise bills later. Many services offer fast, same day prescriptions and common needs. And because visits happen from home, there's no waiting room. So, no need to take time off of work. Telehealth is especially well suited for routine and ongoing care like acne, UTI, birth control, mental health check ins, making it a convenient and affordable option for many people navigating care in 2026. The telehealth platform can be used from your couch. See the price up front, answer a few questions, and chat with a clinician the same day. Your prescriptions are sent to a local pharmacy within hours, and you get no surprise bill weeks later. Another great option for 2026 is the direct primary care play. That is essentially a return to relationship based medicine, focusing entirely on the strength of the patient physician bond. By moving to a subscription based membership where you gain a dedicated health partner who is available for everything from a quick text to an hour-long consultation. This is a game changer for 2026 because new federal regulations finally allow these fees to be paid by the pre tax HSA dollars. It's a proactive strategy that puts your care back in your hands, ensuring expert medical guidance is always accessible while keeping your costs completely predictable. Membership costs are predictable and are designed to be straightforward and budget friendly, typically scaling by age. Individuals usually pay between $70 and $130 per month, whereas families would pay north of $200 per month. It is HSA compatible, and as of January 2026, federal law, the One Big Beautiful Bill Act, allows you to use tax free HSA funds to pay for these memberships, up to $150 for individuals and $300 for families. Here's another great option: community health centers. In 2026, being uninsured doesn't mean you're stuck. It means you have to be smart, loud, and informed. If you think the subsidy cliff means you're locked out of the medical system, think again. In 2026, community health centers are the hidden engines of affordable care. These centers aren't just clinics, they are sliding scale powerhouses where the price of your visit literally shrinks to match your paycheck. You're talking about high quality medical, dental, and even behavioral health services all under one roof with costs that scale down to your income level. Many people don't realize that these centers often have free care days or nominal $20 fees for those who qualify. And when it comes to the pharmacy, the strategy is simple: skip the brand names and ask for the uninsured generic rates. In 2026, savvy patients are getting life saving meds for the price of a cup of coffee. Just be knowing which questions to ask at the counter. Remember, your income determines your discount, but your strategy determines your access. All right. Here we highlight how some of the same medical conditions can result in dramatically different costs depending on where care is delivered. Telehealth and primary care often provide effective, timely treatment for common issues at a fraction of the cost of the urgent care or the emergency room. The key takeaway is that the care setting, not the condition, drives most of the price difference. And understanding these options empowers patients and organizations to make smarter, more cost conscious decisions while still receiving appropriate care. For a sinus infection, it could save you $1,100 if you choose telehealth over ER. As we wrap up today's episode of On My Watch, I want to leave you with one final thought. The headlines might say that 1.5 million people lost their insurance, but what we have seen today is that they are actually finding a better way to navigate the system. The subsidy cliff is a real financial obstacle, but it doesn't have to be a health barrier. Whether you're pivoting to the direct primary care model, utilizing community health centers, or simply asking the right questions at the pharmacy, you are taking back the steering wheel. Remember, in 2026, the system isn't going to hand you a map. You have to draw your own. Being uninsured does not mean being uncared for. It just means being intentional. You make intentional decisions. Keep your eyes open, stay strategic, and ask, is there a better way? Because the answer is almost always yes. If you found today's strategy session helpful, do me a favor, share this episode with a friend who is facing that subsidy cliff right now. Let's make sure no one in our community is navigating this 2026 landscape alone. Don't forget to check the show notes for the cost heat map we discussed today so you have those numbers ready when you need them. I am Dr. Riz, and this is On My Watch. Stay healthy, stay informed, and stay out of trouble.